Today, we are talking about a drug that absolutely changed the game for mental health. It's called Imipramine, and you can think of it as a kind of flawed hero, the very first of its kind that kicked off the entire modern era of psychiatric medicine. It's a really fascinating story about power, risk, and ultimately, an enduring legacy.
To really get why imipramine was such a big deal, you have to picture what came before it. Back in the middle of the 20th century, if you had severe depression, your options were, well, they were grim. This quote really says it all. We're talking about a world of pretty drastic and often dangerous treatments. People were desperate for something better.
And this slide, wow, it just lays it out so clearly. We literally went from these blunt instruments like electroconvulsive therapy and the super long, uncertain path of psychoanalysis to the dawn of pharmacotherapy. This was a brand new idea, that we could actually target the brain's chemistry with a pill. And imipramine, that was the drug that made this whole new era possible.
Okay, so here's how we're going to break down this story. First, we'll look at its revolutionary discovery. Then, we'll get into the science of how it actually rewires the brain. After that, we'll see all the other surprising things it's used for before confronting its dark side. And finally, we'll see where this pioneering drug fits into the world today.
So, let's start at the beginning. A psychiatric revolution. When imipramine showed up in the late 1950s, it wasn't just some new medicine. Nope, it was the birth of the modern antidepressant as we know it. So how in the world does this thing actually work? That brings us to Section 2, rewiring the brain's chemistry. What's its superpower? Well, it all goes down in these tiny microscopic spaces between our brain cells.
And that space is called the synapse. You can think of it like a little communications hub. It's where neurons pass messages back and forth using chemicals called neurotransmitters. Now, for our story, the two big ones you need to know are serotonin and norepinephrine. They are absolutely crucial for regulating our mood.
Okay, so how does imipramine turn up the volume on these signals? Well, normally, after these neurotransmitters are released, they get pulled back in really quickly to be recycled by these things called transporters. Imipramines trick is that it physically gets in the way and blocks those transporters. It's kind of like blocking a revolving door. By doing that, it leaves more serotonin and norepinephrine hanging around in the synapse for longer, which strengthens their mood-lifting signals.
Now this slide is where you see exactly why we call imipramine a flawed hero. Look at that top row. Its main job, blocking that reuptake, is what gives it that powerful antidepressant effect. Perfect. But it's not very precise. It's a bit of a sledgehammer. It also blocks 3 other completely different systems. And as you can see, those actions give you zero benefit for depression, but they are responsible for pretty much all of its frustrating side effects.
And this kind of leads us to a really interesting part of the story. Because of this powerful and kind of broad mechanism, doctors and scientists started realizing imipramine was weirdly effective for a whole bunch of other problems that had nothing to do with depression.
I mean, just look at this list. It's pretty wild. It's still a major player for treatment-resistant depression. It's one of the oldest and best drugs for panic disorder. It can treat chronic nerve pain, help stop migraines before they start, and even manage a really specific symptom of narcolepsy. Its reach is it's remarkable.
But you know what might be the most unexpected use of all? Childhood bedwetting, or enuresis. It's actually FDA approved for it. The thinking is that it works by relaxing the bladder muscle and also making sleep just a little bit lighter, so a child can wake up when they need to go. It's a perfect little example of this drug's really unique properties.
So, with all this power, where does it fit in today's world? Well, it's definitely not the first thing doctors reach for anymore. The best way to think of imipramine is like a specialist. It's the expert you call in for the really tough cases, especially after the newer, safer drugs haven't quite done the job.
And that brings us right to the central conflict of this entire story, Section 4, the double-edged sword. Because all of that power, all of that effectiveness, it comes at a very steep price.
And that price is a really heavy burden of side effects. Remember that chart we saw, the one that showed how this drug hits multiple targets? Well, this is the result. That histamine blockade, that's what causes the sedation and serious weight gain. The alpha-adrenergic blockade, that's why people get dizzy when they stand up. And the muscarinic blockade is the culprit behind the really common dry mouth, blurred vision, and constipation. These are not small things. They can be incredibly difficult for people to live with.
But the most serious risk, the one doctors worry about the most, is its effect on the heart. Imipramine can actually slow down the heart's electrical signals, and that can put patients, especially in an overdose or if they already have heart problems,
at risk for life-threatening irregular heartbeats.
And this right here, this is where the risk just becomes crystal clear. An overdose of just 10 to 20 times a normal daily dose can kill you. The margin for error is unbelievably small.
This chart shows what we call a narrow therapeutic index. As you can see, the space between a dose that helps you and a dose that hurts you is it's dangerously small. This, right here, is the #1 reason why imipramine is no longer a first-line treatment, especially for patients who might be at risk of harming themselves.
All right, so let's wrap this all up in our final section, an enduring legacy. Because despite all those risks we just talked about, imipramine has managed to carve out this really crucial and respected role as a specialist for the absolute toughest cases.
Its whole journey is really captured perfectly on this slide. Back in the 50s, it was this revolutionary new hope for basically everyone with depression. Today, it's a powerful but very carefully used option for when other treatments just haven't worked. It's a real story of evolution in medicine.
And this final thought from our source material just sums it all up. The big lesson from imipramine is that newer doesn't automatically mean better for every single person. Sometimes, the most effective drug for one specific individual might just be an older one, even if it's a lot more challenging to use.
Which leaves us with a really critical question, one that doctors and patients have to figure out every single day. In the super complex, very personal world of medicine, when is a riskier, older drug actually the right choice? It's a powerful reminder that treatment is never, ever one size fits all.